You need to pat yourself on the back. And if you haven't, you do. And I think we all need to give each other a round of applause for all the work we did. So congratulations. So I'm going to turn it over to Benjamin and to Estefania.
Thank you, Stu. Thank you, everyone. Yeah, definitely you have done such a fantastic job with the initiative, and we are so very thankful for everything that you have done and how much you have collaborated with us and amongst you. So the first thing that we wanted to review is the data insights and milestones. And the first thing that I always start with is our aim. What do we want to achieve? And now the question is, have we achieved it, right? So next slide, please. Our aim, we set out to, by June 2023, each NICU will achieve a 20% increase from baseline in the percent of infants who receive skin-to-skin care from at least one family caregiver within 3 days of clinical eligibility as defined by individual unit protocols. And we call that prompt initiation, right? If we started that skin-to-skin care within 3 days of clinical eligibility, we would be doing that measure. So let's see how we did. Next slide, please. So you can see here how our our pilot hospitals did versus our new hospitals. And you can see the new hospitals in the sky blue color, and the dark blue are the pilot hospitals that have been working at it for a longer time. And you can see that we started with the pilot hospitals at 41%. We ended up at 55%. That is a huge increase. And Stephanie, if you can click a couple of times, we can see the percent increase. Just another couple, yeah. That's a 34% increase. And for our new hospitals, that's a 14% increase, which is really, really good, given everything that happened in 2021 and all the challenges that you have all been having. But we have seen improvement, and that's just fantastic. The next slide. As a whole, if we put all our hospitals, regardless of when you all started, the baseline is the first 3 months of data reported versus the last 3 months. You can see that we went from 49% to 59%. That's 10 percentage points, but that is a 20% increase. So again, congratulations to you all. We have met our aim, and that is also just a reflection of the fantastic work that you have made. Next slide. We have been tracking prompt initiation by race, ethnicity, and also by birth weight. And so you can see here that that's what I love about quality improvement. Once we standardize the care that we provide to all our patients, the gaps in health disparities tend to get smaller. And you can see here that your Hispanic and non-Hispanic Black population started with very low percents of prompt initiation, and those went up. Some of them, you can see that it's almost double. So again, congratulations, this is a fantastic gain. For birth weight, we talked in the coaching calls a lot about how difficult it was to start skin-to-skin care in our larger babies, how once they had their clothes on, it was more difficult. Well, you can see that the 25 grams and more represented by the pink line actually had an improvement from baseline to the last quarter. So that again, we can see that improvement for all the birth weight groups, but we can see that our larger babies benefited from the initiative. Next slide. So remember this monster, this was our theory of change. This is what we said, if we do this, we are going to get to our aim. And you see that our potentially better practices are listed on the right of the screen. And we are going to review each one of them because we want to see if we actually did it. And so the first one was to encourage the family caregiver participation in early skin-to-skin care. That's what we reviewed with prompt initiation. We're good there, we did it. The next one is to provide early and continuing lactation support to promote breastfeeding. So next slide, let's see how we did there. So here is mothers on milk at discharge. Again, you can see that there was improvement for both our pilot hospitals, our new hospitals, and the improvement was quite substantial and sustained over time. So this is just huge kudos to all of you. And again, we can see that disaggregated by race, ethnicity, and by birth weight. You can see that at the start, we had some gaps between groups, and over time, those have been reduced, especially for race ethnicity. For birth weight, again, I was very pleased to see that those larger babies that we were talking about in coaching calls and all did get that improvement over time. Next slide. The other one that we wanted to review here, which speaks to both engagement and training, is the percent of family caregivers that received skin to skin care education and training, which is the transfer of the baby from the bed to the chest. And so we saw that there was also improvement for both pilot and new hospitals, and that was a very large improvement. And this is exactly what we want to see in quality improvement. You see that every single quarter, the improvement was a little more, so sustained. Even if the changes are small from quarter to quarter, they are sustained. And that's what over time gets you to where you want to be. And again, if you want to see by race, ethnicity, and birth weight, again, you can see that those gaps, for education, they were smaller, but they were still present. That you can see that at the end, they are much, much, much smaller. So again, fantastic work, y'all. Next slide. Okay, so far we got from skin care, we got a 59% improvement in mother's own milk, and we got 100% improvement in family caregiver skin to skin care education and training. So as we go in the presentation, you're going to see all the other aspects of the initiative, but so far we're going great. Next slide. So all of this is part of the patient level data, the data that you abstracted for us every single month. And I just wanted to highlight a couple of additional measures that we collected in that paired monthly data. Next slide. So we all in all collected 3,462 infants with a birth weight as a mean of 2,253, a gestational age of 34 weeks, length of stay of 26 days. 8% of our patients, of family caregivers, spoke Spanish, and you can see the racial composition on the right. But the biggest thing that we wanted to check for demographics is if there was a change of the population over time. I'm happy to report there was not. We consistently had the same percentages for the several categories. Next slide. For the skin to skin care practice, we really wanted to improve the documentation of skin to skin care. At the beginning of the initiative, at the baseline for all the hospitals, we saw that only 66% of the records actually had a skin to skin care documentation, and that has gone up to 79% in the last quarter. But we have seen that now every single hospital has a system to collect skin to skin care. And that is very encouraging because now in sustainability, that is what is going to get you to sustain your gains, because you're going to be able to continue tracking that over time. So please keep up with documentation. I know it's a pain and it needs to be reinforced, but it's the thing that is going to help you track these measures over time. We also saw that there was an improvement in father engagement. Mothers still provide the vast majority of skin to skin care episodes, but we saw that for fathers, that we always want to encourage them to come to the NICU. It went from 15% at baseline to 22% in the last quarter. Next slide. Regarding skin to skin care episodes by hospital, we went from 88 to 108 in the last quarter. And remember, this is just for the abstracted data, just 10 infants per month. So this is more at your facility, but we have seen an improvement for the abstracted data, which is great. The skin to skin care hours per hospital also went up from 121 to 154. And the average of each episode, which was really surprising and nice to see, went from 47 minutes at the beginning to 85 minutes towards the end. So you know how we spoke so much about the importance of having the baby stay at the chest for at least 60 minutes. This is great because at the beginning we weren't doing it as much. Now we have an average of 85 minutes. So again, kudos to all of you. Next. We were always tracking unplanned events. You know, we have seen this a couple of times. We didn't see an increase in the percent of unplanned events with the improvement in the skin to skin care episodes. And that's fantastic. I just wanted to show you the last numbers that we got. In 2021, we got 3 extubations, which a lot of people were very worried about. In 2022, we only got 4. In 2023, it's only half the year, but we only have 2, you know, so it's not a large amount of episodes that occur. The vast majority of episodes that occur are significant ABD. And the reminder that we have always spoken about in coaching calls, please make sure to let the baby get stable at the chest for a couple of minutes before calling it, you know, at the saturation or a hypoxia. Next slide. All right, Ben, take it over.
Absolutely. So we went through some of our patient level data that we saw, and now I'd like to go through both our hospital level data and our family caregiver survey. Next slide. All right, so at the very baseline of the initiative, we first started for the NICU policy that promoted skin to skin for all eligible infants and family caregivers. Only 7 hospitals were fully implemented in this. In our last quarter reported, we had 23 hospitals that had fully implemented this policy. As well, one key takeaway was that when we look at our staff education, here on our last quarter, we had 75%, so 3/4 of our doctors, NPs, and PAs that have received this education, 84% of our nurses, and 65% of our respiratory therapists. Next slide. For all of our hospital level structural and process measures, the key takeaway here is when we look at our baseline versus our last quarter, we have almost doubled in the amount of full implementation for all of these structural measures throughout the course of the initiatives. That is awesome. Next slide. All right, so now we will get into our family caregiver survey. Next slide. So we got a lot of very meaningful information from our family caregiver survey, and I just want to give a big shout out for everybody that helped put this out over the course of the initiative. We saw in quarter 1 of 2022, when we first rolled it out, we only had 19 submissions. If we look over the past year, we've seen around 150 surveys submitted each month across our initiative, and we've totaled 728 surveys completed throughout. So great job, everybody, on rolling this out. Next slide. Okay, so some of the information that we got was more telling about how the caregivers felt in their stay in the NICU. And we see here that an overwhelming majority of all of our caregivers in the NICU felt that the NICU team encouraged them to be present and participate when they made their daily rounds on the baby, encouraged them to spend as much time with their baby as they wanted, encouraged them to be with their baby as often as they wanted, and helped them feel like they were truly the baby's caregiver. So great job to everybody out there. Next slide. For those that had their first encounter in the NICU with their baby, we saw that 61% were able to hold their baby. And of those that did not have that chance, the 37% that did not get to hold their baby, we saw that an overwhelming majority of that was due to the baby just being too sick or unstable to hold the baby. Of that, we did see when we look at the activities they were able to do when they weren't able to hold their baby, we saw that a lot of them sat at the bedside, gently touched the baby, talked and read, held their hand, or breast pumped at the bedside. So that is really, really good that they had activities to do while they were not able to hold their baby. Next slide. So dignity and respect, one of the pillars of family-centered care. The percentage of caregivers that reported talking to the NICU team in detail about what they can expect from the NICU, we saw that when we first rolled this out, we had 63% in our first quarter and 79% of our caregivers that had this talk. If we look over the course of the past year with our quarters, we stayed well above 90% the entire time. And of those family caregivers, they felt that the NICU team tried to understand their culture or background, talk with them in ways that respected their culture and background, helped with their family needs in other ways than medical care, and respected their family the same way that other families and caregivers were respected. And if you look at this, it is well over 75% of caregivers that strongly agreed with all of these things. Next slide. In communication, it's very, very important that all of the doctors and nurses in the NICU were able to communicate with all the caregivers, and we see a strong majority of every respondent strongly agreed that the NICU doctors and nurses were able to answer all of their questions, communicate in an effective way, talk to them regularly, and have answers to all of their questions. Next slide. And with that, I'll be passing it back to Dr. Rubio.
Thank you, Ben. That was a great review. And, now as a whole, this is our theory of change. You can see that we did have a 20% increase in the prompt initiation of skin-to-skin care, 59% improvement in mother's own milk, 100% improvement in creating a culturally sensitive environment. We saw that most units now have a skin-to-skin care unit policy that is a 228% increase, more than a third had a skin-to-skin care policy at the beginning, and now most of you all have it. And then for education, we have 100% improvement for the family caregiver education, and for your staff, there is an increase of 150% in the education provided to your staff. So you can see here that we have hit every single one of our potentially better practices. You have done outstanding. And we really hope that when you get your report this time around and your certificates of achievement, you get your teams together and you celebrate, because all the hard work that you have done has paid off and you have done amazing, amazing improvement. Next slide, please. So this is a stingy little graph that I really like. The Institute for Healthcare Improvement put it out, and it talks about the walk and the road of quality improvement, how we got started, how we went through it, how we did the learning sessions, we had the initiative meeting and all that. Well, now we're towards the end. So that is the quarter that is in the lower section of your screen. And you can see that now we're doing the respectable closure. We are celebrating with you all. We hope that you celebrate with your teams as well. And we encourage you to hold the gains by publishing, disseminating what you achieved. And then once you receive your report, choose those measures that you want to track over time and get together with your teams every 3 months or so to review how you're doing and to adjust where needed. And so with that, I'm just going to open the floor for questions. So next slide, please. We're just going to stop for 5 minutes or for 5 seconds. If anybody has questions, please raise your hand or just unmute yourself, come out of chat, out of mute, and let us know your questions. I don't see any questions at the moment, but if you have any questions, put them in the chat as well, or just, as I mentioned before, raise your hand and come out of mute and we'll have a little chat. Other than that, I don't have anything else for you at the moment. I'll let Sue take over with the next section.
Thank you. I mean, I can't get the smile off my face. That just makes me so happy. And with that, I want to turn it over to Dr. Hudak, who really led us on this journey over the last 3 years. So Dr. Hudak, I'm going to give the floor to you.
All right. Well, listen, I apologize. I unfortunately arrived 10 minutes late, so I don't know exactly, some of the things that have been said. But I will say, this was really a very exciting feel-good project, I think, for everybody. And I'll speak for Dr. Shuklin and Dr. Colby Day, who also were physicians who helped put this together and work with the incredible team at FPQC on this. They feel the same way, that this was really just a dynamite project, and we pulled it off despite COVID and all sorts of other obstructions. I'm particularly blessed, I think, to have worked with all of you. I really enjoyed all of the monthly calls that we had. I learned a lot from everybody. And I hope you feel that that was a good format for sharing information and insights and, better ways to do things with everybody else. And I think, just looking at these pictures here, clearly a lot of people had fun dressing up as kangaroos. What a great collection of pictures. So, I think that this was an important effort. I think, other efforts that we've done have really been focused, on discrete outcomes in the babies. This is the first one, I think. I think maternal breastfeeding was one of them, but this one comprehensively pulled the family into it, mothers and fathers and siblings and relatives. And this is something that hopefully we spent a lot of time talking about sustainability. Will actually be sustained for those of you who do the next initiative, which will be focused on transitions and empowering families to be fully participatory in during the stay and be capable and confident, when they take their babies home. So just again, I have nothing else to say except, kudos to everybody. And as I said, I'm blessed to have been able to work with all of you.
Thanks, Mark. I really appreciate it. It's been a pleasure working with you as well. You really led this initiative from the beginning, and we're so grateful to you. And now I want to turn it over to Laylis Vernon, who has been our family liaison, something that's fairly unique to our project here in Florida and unique to Florida. So Laylis, I'm going to turn it over to you.
Okay, well, hello everybody from Buenos Aires, Argentina, live from Argentina, and I wouldn't miss this for anything. I'm so proud of. I'm authentically proud of our work here with the FPQC and with all of you guys. I think that those numbers, are so impressive. And as a family partner that is dedicated to great with you on the data side, I'm impressed by the numbers, right? The numbers speak for themselves. And so I think that I have three quick points for everybody. Kudos on the improvement. And then I'll lace it up with some challenge for all of you. I saw that 108 episodes for Skin to Skin with families. The 85 minutes of Skin to Skin, and I loved the 228% increase or improvement in the collaboration with families from the driver diagram that Stefania showed us. And so that to me means that we are capable and skilled enough to do it. So, in quality improvement, we can measure everything and we can achieve great things. The challenge is always in sustaining, right? So I'll leave it to you with a huge kudos and a challenge to say, hey, this is just a departure platform for all of you. I think that the second biggest point that I need to make is how strong our project was. And it was so because we were able to partner with community groups. In our case, it was ICU Baby. Elizabeth Simonthon can be present in this call today, but I'm texting with her. And I have to say that their collaboration has been a tremendous part of this project. And I usually talk about how quality improvement can't happen in isolation, right? It's not a unit-based data set. And mostly important, we do it at a state level, but it is important to recognize where those voices of the consumer are. And in our case, it was finding the voices of families, the fresh feedback on how care is being delivered and how Skin to Skin is being done from these families that are part of Baby. So in the future, as you embark in new projects, I also invite you to always look at your community and Google and see and reach out to those groups that are actively working for families and with families in your hospital and your community. And lastly, I want to tell you that, as you know, I'm involved in other projects and other entities and at other levels of science and family engagement. And I think we have done something very unique with this very special co-designing of this project. I know I've presented many times over the last 2 years about how this community group of families informed our driver diagram and the family survey. and how valuable that is. And it is important because people need to know that this is happening, right? And so I've made a lot of publicity out of this special engagement that we had here in FPQC. I hope you see the value too. I think you do. And again, quality improvement is not really existent if you don't have the voice of the consumer, right? You can't just measure one side of the cycle of care. You have to know how it's being done and how it's being received. You have to listen to the other side. So with all of those 3 quick points, I'll say muchas gracias. and I'm always here. The same for the rest of the team. The team, I can't say enough about this team. It's just a team of rock stars. Thank you so much to Sue and Mark and Linda and everybody in the FPQC for giving me the voice and the space to come with my lived experience as a NICU mom and bring others along the way. I sincerely thank you for this opportunity.
Thank you, Leilis. Bravo. We wouldn't have been half of where we are without you. So thank you, thank you, thank you. We thank you as much as you thank us, even more, because I bow to you. You've really helped us along the way. You've kept us focused where we need to be focused, which is on the families. So thank you so much. So with that said, now I would like to move on and let's talk about stars, because you are all stars in my book, every one of you. So if we could look at that, the stars, and we're going to go talk about stars now. I mean, unfortunately, we don't have a walk of fame. Maybe we need to someday. And, you know, I don't know. Anyway, so remember, you're going to receive a star for each of the metric that you met. So the first one is engagement, skin-to-skin care outcomes, documentation, provider and staff education, and survey implementation. So with that, let's talk about the first star. So engagement, what that was, this is what you're going to receive: 70% on a coaching call participation and up-to-date data. Your outcomes, improvements in any of the metrics, baseline to last quarter for your documentation, 70% or plus of the staff educated, and implementation of the survey, or you have a family advisory council in place. So with that, let's look at our stars. So for engagement, congratulations to these hospitals: Baptist Hospital of Miami, Cleveland Clinic Tradition Hospital, Halifax Health, HCA Florida Brandon Hospital, Joe DiMaggio Children's Hospital, John Hopkins All Children's Hospital, Jupiter Medical Center, Memorial Hospital Miramar, NCH North Naples Hospital, Northwest Medical Center, Sala Foundation Children's Hospital, Broward Health Medical Center, South Miami Hospital, Tallahassee Memorial Hospital, Tallahassee Memorial Healthcare, Tampa General Hospital, UF Health Jacksonville, Wolfson Children's Hospital. Congratulations on your star. Okay, our next star, our outcomes measure improvements, skin to skin, Advent Health for Children, Baptist Hospital of Miami, Baptist Medical Center South, Golisano Children's Hospital of Southwest Florida, Golisano Children's Hospital, University of Rochester Medical Center, Halifax Health, HCA Florida University Hospital, Holtz Children's Hospital at Jackson Memorial Hospital, Joe DiMaggio Children's Hospital, Lawnwood Regional Medical Center, Memorial Hospital Miramar, Memorial Hospital West, Mount Sinai Medical Center, NCH North Naples Hospital, Northwest Medical Center, Sala Foundation Children's Hospital, Broward Health Medical Center, Shore Point, Port Charlotte, South Miami Hospital, Tampa General Hospital, US Health Jacksonville, Winter Havens Women Hospital. Congratulations. Okay, our next measure, documentation. This is the one we all struggled with. I know, and we still do. Congratulations. Advent Health for Children, Baptist Hospital of Miami, Baptist Medical Center South, Cleveland Clinic Tradition Hospital, Golisano Children's Hospital of Southwest Florida, Halifax Health, HCA Florida University Hospital, Holtz Children's Hospital at Jackson Memorial Hospital, Joe DiMaggio Children's Hospital, John Hopkins All Children's Hospital, Jupiter Medical Center, Lawnwood Regional Medical Center, Memorial Hospital Miramar, Memorial Hospital West, Mount Sinai Medical Center, NCH North Naples Hospital, Northwest Medical Center, Shore Point, Port Charlotte, St. Joseph's Hospital South, Tampa General Hospital, and UF Health Jacksonville. Congratulations. Our next measure, provider and staff education improvement, Advent Health Tampa, Baptist Hospital of Miami, Baptist Medical Center South, Cleveland Clinic Traditional Hospital, Golisano Children's Hospital of Southwest Florida, Halifax Health, HCA Florida Brandon Hospital, HCA Florida University Hospital, Holtz Children's Hospital at Jackson Memorial Hospital, Joe DiMaggio Children's Hospital, John Hopkins All Children's Hospital, Lawnwood Regional Medical Center, Memorial Hospital Miramar, Memorial Hospital West, Sala Foundation Children's Hospital, Broward Health Medical Center, Shore Point, Port Charlotte, South Miami Hospital, St. Joseph's Hospital South, Tallahassee Memorial Healthcare, Tampa General Hospital, Winter Haven Women's Hospital. Congratulations. Next slide. And our family-centered care measure improvement, Advent Health for Children, Advent Health Tampa, Baptist Hospital of Miami, Baptist Medical Center South, Cleveland Clinic Tradition Hospital, Fort Walton Beach Medical Center, Golisano Children's Hospital, University of Rochester Medical Center, HCA Florida Brandon Hospital, Halifax Health, HCA Florida University Hospital, Holmes Regional Medical Center, Holtz Children's Hospital at Jackson Memorial Hospital, Joe DiMaggio Children's Hospital, John Hopkins All Children's Hospital, Jupiter Medical Center, NCH North Naples Hospital, Sala Foundation Children's Hospital, Broward Health Medical Center, South Miami Hospital, St. Joseph's Hospital South, Tampa General Hospital, Wolfson Children's Hospital. I think is that 5? I think I counted 5. Next slide. Yeah, so this is what the certificate's going to look like, guys. And you will have your stars on there, and we will be mailing these out to you, so you will get this certificate. Next slide. For those of you who met your kangaroo-a-thon hours, we would love to know. Some of you have already turned it in. You've turned in your photos, but let us know, because we would love to award you these certificates as well, so you can have your stars and your kangaroo-a-thon certificates both hung together. Okay, so congratulations, big round of applause to all of you. You guys did a great job. I can't say thank you enough. You made this such a rewarding project for all of us. And for those of you who don't want to stop and want to keep going in sustainability, we want to talk about our next project, which is called Homeward Bound. And I really want to, most of you know, Stephanie's done most of our slides, and she developed that wonderful logo that's up on the top of the slide for this next initiative, which we called Homeward Bound. And I'm really proud of the name, everybody, because that name, with Laylis's help, was selected by our families. They're the ones who named the initiative. So please keep that in mind. But what we want to do is by June 2025, participating hospitals will achieve a 20% increase in discharge readiness for NICU infants as measured by parental technical readiness checklist completion and an emotional readiness score by parent questionnaire. And our secondary aim is that our hospitals will have a 20% increase in a completion of a discharge planning tool upon discharge home. And our drivers are going to be family engagement and preparedness, health-related social needs, and transfer and coordination of care. Our advisory group is busy putting everything together for the toolkit, so it will be ready. We'll probably be sending out our information so that you can sign up. I think we're looking at August. In October is when we're planning to have our kickoff. And for those of you who are interested in this, we'd love to have you sign up. Our speaker for our keynote speaker for the kickoff is Dr. Vincent Smith. He's coming to us from Boston, and he's helped write a lot of the information that we hope to use with this initiative. Mark, do you want to add anything to this?
No, I think this is this project came out of insights I think that we achieved during our project. I think this is a way, like I said, that will cement some of these cultural changes within the NICU and continue to engage families in a very meaningful way, which will mean a lot to them and their kids as they're growing up. So I think Dr. Smith is excellent. He's going to be a great kickoff speaker. He's very versed in the field, very hands-on, and does a wonderful selection, and I'm thankful that he agreed to do it.
And Laylis, how about you? I know you were very involved talking to the families about this as well.
Yeah, I think that universally, the families, this is a big need for families, right? The transition to home. And so I think the families are going to have a lot to say. I'm looking forward to collaborating and seeing how we're going to shape and give all these experiences, meaning. But yeah, I think this is a great need. And I know that a lot of hospital teams have worked on this. I've been involved personally in a couple of QI cycles with specific hospitals, but at a state level, I am very, very excited to see where we're taking it. And again, this is going to be a partnership with families for sure. And hopefully we can produce some good results for all our families and all our babies in Florida.
Perfect. So I just want to invite all our teams to look for that recruitment letter, which will probably be coming out in August. And with that, I'm going to turn it back over to Lori.
Thank you. You guys did a wonderful job. The data is very exciting, and I am so grateful for all the work everyone has put into this. If you really want to get ready for the kickoff for the Homeward Bound initiative, if you're planning to participate, you can put October 18th on your calendar. So our kickoff will be in Orlando at Celebration, where we've held our last few meetings, and it will be all day on the 18th of October. So let's put it on your calendar if you think you're going to be joining us. Are there any other closing slides? Stephanie, is there anything after this one? Just this last note. You guys are the best. The numbers are so impressive. We are very proud of the work that you have all done. Thank you to our leadership team for everything they have done to guide this initiative. And we will look forward to seeing you in Homeward Bound. Thanks, everyone.
Bye, everybody. Thank you again. You all rock it.
Thank you, everyone.
Bye.
Thank you, everyone.
Bye now.